Symptoms that may suggest that you're having high blood pressure. In this video, I'll be telling you 10 symptoms that you should never ignore. Once you notice these symptoms, don't ignore it. However, most at times, high blood pressure do not show symptoms because the body has a way of adapting. Okay, if your blood pressure has been come so long for a while, probably you're having headaches, and that is the symptoms you're getting, and you didn't do anything about it, your body will adjust. So most at times you may not know that you're having blood pressure. So to be on a safer side, make sure you check your blood pressure as often as you can. It's really literally free. You can go to any pharmacy, they will have it checked. Okay, however, for the purpose of this video, I'll be telling you about 10 symptoms, and when you experience these 10 symptoms, please do not for any reason ignore them. Okay, now what is blood pressure? Blood pressure is the force that the blood exerts on the vessels of which it contains. Okay, now in checking your blood pressure, there is the number, usually see two numbers, the one up and the one down. The one up is called diastolic, while the one down is called systolic. Now, how to know the ones that are normal? Any number that the up one should be between 120 to 129. Okay, if it's above 120, please see your doctor. Then the down one, if it's above 80, please see a doctor. Okay, now let's get to the symptoms. I forgot to mention, my name is Nurse Merit and I'm a renal nurse or a nephrology nurse. So let's get to it. Make sure you watch till the last symptoms, because the last symptoms is the most important of them all. Number one, headaches. When you have headaches, especially headaches that radiate to the back, please do not ignore. This usually means most of the times when the blood pressure is high, it will make the pressures, the blood vessels that supply the head, increase the pressure in the head, and then you have headache, especially pounding headache. Please do not ever ignore this habit of just taking paracetamol all of the time or taking painkillers. When this thing becomes so much, you've taken it once, two times, the next thing to do is to go and see a doctor for proper medical check of what is actually going on with you. Remember, abusing NSAIDs, abusing all these painkillers can damage your kidneys. I've made a video on 12 things that can damage your kidneys. Please, you can locate it here and watch. Number two, blurry vision. Yes, when your blood pressure becomes very high, it can burst blurry vision, or you can see double vision. Okay, just see if you're seeing double vision. So this usually occurs when your blood pressure becomes so high. Most of the times it goes in and bursts any of the blood vessels supplying the eye, the tiny vessels of the eye, and most of the times you can even start bleeding, or you might not really know. So this will impair your vision. So whenever you start feeling that you're not seeing very well, or you can't see, or you're having blurred vision and all of those things, please make sure you see a physician as fast as you can. Number, fatigue. Yes, having fatigue can be another symptom of high blood pressure. This is because when your blood pressure becomes so high, it impairs the way your heart pumps blood. Okay, your heart pumps blood and then divides it, supplies it to other parts of your organs. So it's your heart is beating, is working times 3 of what it should do. So it distributing blood will not be so easy for the heart. So this makes you tired, and also it can impair the way you take oxygen, the oxygenation of your lungs also. So you see, because you're not getting enough oxygen, enough blood supply, okay, you will become fatigued. Okay, number 4, chest pain. Chest pain can be a sign that your obvious symptom that you're having your blood pressure is high. This is because when your blood pressure becomes so high, it impairs the way it supplies blood to every part of your heart and some part of your system. And most of the times, if blood is not supplied adequately, you may have myocardial infarction. Okay, you might have some certain cardiovascular issues. So whenever you're having chest pain must not be just chest pain. If it's radiating at the back, at your neck, please look at the video of where you may know that you're having stroke. Okay, and I think I'll also make a video on how to prevent stroke and how to make your heart healthy. So when you're noticing these signs, okay, or your heart is as if it's skipping, please do not ignore. Okay, so the number 5 way symptoms of blood pressure is weakness. Yes, especially focal weakness. When you notice that a part of your face, you're weak, you're feeling weak in a part of your face, or your lips, or your hand, a part side of your body, okay, you should really see a doctor. You may have had stroke, okay, because when blood is depleted in any part of the our body supply to any part of the organ, because the blood pressure is excessively high, somebody may have stroke. And part of the signs of facial drooping of stroke, you see the person's face is dropping like this, the lips is dropping and all of those things, or you're feeling weak in any part like this, one side of this. Please, this should not be ignored. Okay, now the next one is vomiting or nausea. Vomiting and nausea is actually different. Okay, nausea means you're having the feeling that you want to vomit. Okay, why vomiting is actually vomiting, you actually vomit. So this can be an indicative symptom of high blood pressure, especially when this does not happen to you all of the time. Okay, when the tiny vessels in your brain has been ruptured as a result of the increased blood pressure, okay, and it's leaking, and okay, it makes you start feeling nauseated or start vomiting actually. Or maybe you've had stroke and you're not even aware. Okay, this will obviously makes you start vomiting. Okay, so please do not ignore, especially when this thing is not often with you. Okay, now the next one is shortness of breath. What is shortness of breath? Sometimes you feel you can't breathe properly. You feel you can't actually breathe, like there's some fluids in your chest. For people that are having pulmonary edema, the whole thing is that you can't breathe. So shortness of breath can actually be a sign that a symptom of high blood pressure. This occurs if you are having there's pulmonary edema, like I said, okay, and as a result of excess high blood pressure, excess blood pressure. Okay, there can also be as a result of your having stroke too. This can also be as a result of decreased blood supply to the organs. So of course the organs are not oxygenated very well, also as a result of increased high blood pressure. So when you're having shortness of breath, please make sure that you go get checked. Now the next one, which is number 7. Okay, before that, please, I'm going to make a video on how to lower your blood pressure naturally. Please make sure you locate that video. Okay, so this is why you need to subscribe and turn on your notification button for this channel, because definitely you will learn a lot. So the number 8 sign, I beg your pardon, is back pain. Yes, I know you're surprised, but back pain can be a symptom that you're having high blood pressure. This is because when the blood pressure becomes so high, one of the complications is what is called aortic dissection. So this means your aorta bursts open and then start leaking blood down. Okay, so when this happens, one of the major signs of aortic dissection is back pain. So you see, whenever you're having any of these symptoms, whether in regards to high blood pressure or not, please, severe back pain, please make sure that you go for checkup. Now the next one is nosebleeds. Okay, that's the next number 9. Okay, so the nose has some nasal blood vessel supplying it. So when the blood pressure becomes so high, it can cause these vessels to rupture and you have nosebleeds. So please, if you're having nosebleeds, make sure you see a doctor. And Okay, I think I'll make a video on nosebleeds. People that have nosebleed, what are the causes? So for the purpose of this video, if this happens, remember other symptoms, headache and all of those things. Please, if you ever notice nosebleeds, please do not take it lightly. Make sure to go get it checked. Now the final one is this last one is actually the most important. Okay, just like I from the onset of this video, I told you that this last symptom is actually the most important, and that is nothing, no sign. Most of the time, blood pressure do not show you sign. Just like I explained earlier, you can become your body can adapt, okay, with having high blood pressure, and it won't show you. You won't even know that your blood pressure is 230 something over maybe 150. Okay, so please make sure, this is why high blood pressure is termed the silent killer. So please make sure that you go get checked. It is free, absolutely. So please get checked. And when you're on those drugs, please make sure that you take your drugs judiciously and do the things. I have natural ways I have a video here on natural ways that can help you manage your blood pressure. I'll still make more videos on how to manage blood pressure naturally, and then foods to eat. Please locate those videos, it will really help you. And if you're taking your blood pressure medication, make sure that you always go back for your doctor's appointments, check your kidneys, okay? And please stay safe. Remember, high blood pressure and diabetes unmanaged is the leading causes of chronic kidney failure. I hope this video has helped you. Like, share, let me know your questions in the comment section, and you can follow me on all my social media handle. Have a lovely day.